Hey everybody, it's Dr. Zach Beatty with Gonstead Family Chiropractic, and today got a couple props here. These are 2 golf balls, and you're probably wondering, what is a chiropractor doing with 2 golf balls? Well, we're not going to be playing golf today. What we're going to be talking about is plantar fasciitis. It is a very common diagnosis, especially nowadays. We're hearing it a lot more than we used to, and the reason that we have this is not what a lot of people think. So what we have going on within our foot is, I'm going to try and use this as an example, or actually, you know what? Let's use my actual foot, better yet. So let's get down here to this. There you go. So in our foot, we should have an arch like this, right? Should go up. When we step, it starts to put pressure on it, and some people's will go in like that. So from the front view, should look like this. When we pressure, some people will go in, putting pressure on their foot, also their knee. And so what we want to do is we want to talk about that. So the reason that we're going to talk about it is because we see it all the time in our office. And so plantar fasciitis, in short, is basically where the arch is like this, and then it flattens out. And when it flattens out, think of your hand. When it goes like this versus that, it starts to pull and stretch. What it will do is it'll start to pull and stretch underneath your foot and start to pull on your heel. A heel spur. We see that and hear about that. That's a very common term. And so that heel spur becomes very, very painful, but so does that stretching. That stretching pulls the tendons, the ligaments, and muscles, and then people start to get tight calves and tight Achilles tendons and things like that. So what we want to be really conscious of is, what are we doing to our feet? Why are our feet going from an arch to flat? And so inserts are huge. So make sure you guys have proper inserts. There's a couple companies that I think are good, and I think they have a really good price point, versus I see a lot of people paying hundreds and hundreds of dollars for these inserts, and I'll be honest, I don't know if they're any better, and that's just my own take on it. But let's get into the exercise here real quick. So give me just a second. Let me get my other shoe off. Let me get the camera set up for us. All right, let's see if this is appropriate. Awesome. So what we're gonna do, we're gonna take these 2 golf balls. We're gonna place them under here. You're gonna put it underneath your foot, and you're gonna roll around. The reason I have 2 is because I have 2 feet. What this is gonna do, you wanna focus on keeping it right under here on the arch. So again, right there, and roll it around. There's a bone right here that's called our navicular bone. That'll help keep your arch up, keep you healthy, keep you running strong. So I hope this helps you guys. If you have any questions on it, please feel free to reach out to us. Can't wait to see you guys soon. Take care.